Hi, Jackie Van Ruler here, and in today's video we're going to be talking about low back pain. Did you know that low back pain is the #1 reason why people are go to the ER for pain or irritation or things like that? If you're not already subscribed to my Instagram channel, I do put these face maps on my Instagram page so that you can follow along with them or do them at your own convenience without having to watch the full video. That being said, make sure that you subscribe so you don't miss any of my future videos, and like this video so that more people will see it. We're going to start with this area of the face here, which has to do with the low back. We're going to start right here in the center, which is a low back area. And then you can move to the left or to the right, it doesn't matter. And you're gently moving your magic wand, feeling for any areas that feel stuck or stagnant or feel tender, or even that you might have any abnormalities on your face, breakouts, scars, anything like that. Those are all showing you where you have disruptions in the energy flow of your body, particularly in the electrical flow that happens within your nervous system. So I'm noticing on the left-hand side that it's feeling a little more lumpy and bumpy than it did on the right-hand side. So because of that, I'm going to work it just a little bit longer. Next areas we're going to work are the kidneys. The kidneys have a lot to do with low back pain because your kidneys are located within your low back, but also your kidneys are about flexibility. So they help to hydrate and nourish your connective tissue. It keeps your body nice and flexible. When the kidneys are out of balance, your connective tissue will become more stiff and stagnant. So our kidney points are going to be located in the corners of the mouth. Bring your fingers all the way up to your hairline and down just a little bit. This area might feel a little bit, kind of like you can fit your fingers in it, maybe a little bit more loose than the area around it. Can be kind of hard to find your kidney points, so if you can't find them, just work a larger area. The right kidney is about heating up the body, and the left side is about flow, so the flow of water, the flow of energy. Okay, the next area that we're going to work some areas for pain relief. So we're going to work 124 and 34. That's going to be about right here, about halfway between your brows and your hairline, and about 2/3 of the way across your brow, and then right here above your inner brow. So you can just take your magic wand and go back and forth here. If you feel an area that feels lumpy or bumpy, you can just work that area. I have a little liver spot right where my gallbladder spot is, right here, right where this 0.124 is. And so mine is marked on me. And that actually is one of the areas of my body that tends to have issues, is the gallbladder. And so that will show up on your face a lot of times where you have abnormalities, even if it's just a scar or a mole or something like that, will show up where your body has a tendency to have energy depletion. Okay, these spots should feel very relaxing and calming. Can help with pain relief, give you somewhat of a sedative effect. They can help with sleep. This point here is also really good for relaxing the shoulders. If your low back is painful, you probably are going to carry a lot of tension in your shoulders as well. So while this is not specifically a low back point, it will help with that as well. Okay. Next area we're going to work is this whole lower part of the nose. So if we think of the nose as our back, this would be our head, neck, upper back, mid back, and low back onto the sacrum here. We want to work this whole area in here. We have some more kidney points right in here. And then this is a point that's my favorite point for the low back, which is right here on, not the very tip of the nose, but close to it. So working in here, noticing how that feels. Does it feel firm? Does it feel weak? Does it feel tender? Do you have any facial abnormalities on that area? So just working this whole area in here. This area in here is going to be the kidney spots. The kidneys take a long time to get out of balance. The kidneys are an organ of time. So it can take a long time for them to get out of balance, and it can take longer for them to get back into balance. So if you're experiencing low back pain, this is something that you're probably going to want to do several times a day, and it might take a few days before you even notice a difference. So don't get discouraged if you don't notice a difference right away, like you do with some of the other protocols that I give you. Anytime we're working with the kidneys, it does take more time. One additional thing that you might want to consider is looking at the number of oxalates in your diet. Oxalates are these little crystals that can get wedged between joints, and they can affect your kidneys as well. Oxalates appear in food like spinach, almonds, beets, kiwi fruit. Most grains have some as well. And so looking at oxalates in your food, seeing how much you're taking and reducing the oxalate content can be very helpful for anything kidney related and low back pain. So I'm just pulling up my face map here again. Next, we're going to work our spleen and stomach areas. These are on the left-hand side. So in line with the bottom of the nose, directly over the smile line, we have this point for the stomach. And then if you go slightly up and directly underneath with the iris of the eye, we have the point for the spleen. Both of these are going to have to do with your muscle strength and any muscle pain. So helping to strengthen your muscles and then also relieve any muscle pain that might be occurring with your back pain. And then we're going to move to the right-hand side. In line with the bottom of the nose and directly underneath the iris of the eye, we have the liver. The liver is going to help with relaxing and smoothing out the ligaments and tendons. And if you go a little bit to the right of the liver, we have a gallbladder point. So working those 2 points are going to help with any ligament or tendon issues that are associated with the low back pain as well. And then I forgot to work this area right here on the pad of the nose. So if you have more sciatica pain, more pain right at that tip of the sacral bone, you can work this area as well. This area will also help to reduce any heat. So if you have a lot of heat with your pain, this will help to cool down your body. And then finally, we're going to work some points for inflammation. So above the upper lip and here and right into the smile lines. Now, if you're pregnant, you want to avoid points on the upper lip. However, the main points you want to avoid are these. So you can choose if you want to do this or not. If you just want to take it easy and just be very, very careful, you might just skip these points. These are more just to reduce inflammation in your body. So this is a point for the adrenal glands. And then this point in here is boosting the immune system. As always, whenever we do any protocols, at the very end, we want to finish up by working around the ears. And in this space, especially because the ears are related to the kidneys, any body part that has the same shape as another body part is related. So when we look at the ears have the same shape as the kidneys. And a lot of times when you have ear issues, it's also related to the kidneys. Things like hearing loss, tinnitus, ear infections, things like that are often related to kidney issues as well. So working down the front side of the ear, up the back side of the ear, or if you can't do that because you have earrings in or hearing aids or something like that, you can work up and down that front side of the ear like this. Either way is fine. So this just sets that formula in, helps it to work longer, stronger, and better, and also brings your body back to a state of regulation. When we work around the ears, we're working point 0, which is a regulatory point. It's also one of the strongest kidney points as well. So this is also going to really amp up the improvement in the low back pain. As always, please comment below. Let me know how this felt. And be sure to subscribe. And if you need a magic wand, I will put my email in the link below. You can just email me for that. I can send you an invoice and get that sent out to you if you live in the US. If not, please follow my list of practitioners and find somebody in your area who might carry them. Thank you for watching. I'll see you next time.